For the first time, the Centers for Disease Control and Prevention is recommending that everyone older than 6 months be vaccinated for the flu. And of course, that includes us and most likely you.
That's right. I have never had a flu shot before.
It amazes me.
I know, it's amazing. So
I get one every year.
My first experience coming up, and you know, here's the interesting thing. I may be able to predict the weather, but it's hard for me to predict when the flu is heading my way.
Yeah.
So I figured it's about time this year that I take some steps to
Right, and we're going to do it together.
Prevent it.
We're going to roll up our sleeves in a minute, but first we have Dr. David Dobby, an infectious disease specialist of Spectrum Health Medical Group here, along with Marcy Custo, an RN from the Spectrum Health Continuing Care Visiting Nurse Association. And we're not too nervous.
Until we saw the needles.
Be getting a shot. This is the first for you. Why is it important, Dr. Dobby, to get a flu shot?
Well, flu vaccine has been around many years. It's been around since the 1950s. It's both safe and effective, and I think it's become increasingly recognized that people that are otherwise healthy respond the best in terms of it preventing the flu. The people that have the highest chance of having complications of the flu are the very young and the elderly, or people that have underlying medical conditions. For them, the flu vaccine is safe and effective as well. But the most important thing I think is being recognized is that transmission between people and the size of the epidemic and the amount of the spread can be significantly reduced if we immunize everyone.
Right.
And there's no way to protect infants less than 6 months of age except if we get their household contacts, their community contacts immunized against the flu.
We know, and a lot of us, you know, I don't have kids in that age group, but I work in the church nursery sometimes. I'm around a lot of people all the time. Of course, my mother-in-law is 82. She lives with us, and so, you know, a lot of us that may think we're healthy enough to fight it off on our own need the boost that comes with the flu shot.
Well, even for the people that are healthy enough to fight it off, you can still miss several days of work and feel really bad for a few days to a week, so that and in the epidemic that occurred this last fall and
yes, and it was really complicated because we had H1N1, but it's a lot better this year because that is included in the flu vaccine, included in the shot that we're going to get today.
The vaccine now has the seasonal flu vaccine has 3 different strains of virus. This year it includes the epidemic flu that we had, H1N1, and that particular epidemic was different than what we usually see in that it caused serious illness in younger people, small children, and young adults, and many of them became ill, and that's where most of the mortality was. That's where most of the people dying was.
And I think that was why there was such concern, too, when so many people then wanted to get the flu shot and they didn't have enough, didn't have access. Okay, so
all right, we're going to
flu shots that are available, you've got all the information here on the screen.
Yeah.
You guys have them 7 days a week.
Centers.
Taking off my sweater. Rachel, you know what? I'm standing
I'm anxious. I've been
closest here, so I'm going to go first here. I always love, when my kids needed immunizations, I always took them to somebody who did a lot of shots because I figured it wouldn't hurt.
So we're going to do this, and you're actually going to be able to see the process and how easy and hopefully painless it is.
Hey, it's done already? I barely even felt that. Let me step over here.
Okay.
And
let you get
right? Here.
Yeah, I think I took a deep breath.
Maybe not a lot of payoff too. It is important, $35, but that's a really good investment because we're talking about, you know, here at Wood TV, we actually have them that our employer pays for because it amounts to time off sometimes and, you know, spreading to your family.
It's a good investment for your employer, and it's a good investment to protect yourself and your family.
Okay, I have to ask you, what about for college kids? I've got 2 kids in college this year. Getting them for your college kids a good idea too?
Oh, absolutely. I have always, you know, with college kids, you're talking about a clustering of susceptibles who are sharing secretions potentially. It's
Wait a minute. I don't want to think about that.
There's a lot of potential for spreading of
sharing
disease.
cups, sharing straws in close proximity.
Now, I can attest, that didn't really even
I know, I
hurt
barely
that
even,
We have very fine needles.
Right,
and
they were
the
long,
technique
though.
was good too, right?
That's right. Okay, I'll get my Band-Aid on here too. And thank you very much. And of course, check out the website.
Thanks for being gentle, Marcy.
Yeah,
we appreciate it. Thank you, Dr. Dobby, for coming.
So now when we take sick days this year, Rachel, it's because we're going to be shopping.
Yes, exactly. We'll have all the information on our website. We'll be right back.